So heart catheterization is where we put an IV in an artery. We usually use the wrist. Occasionally we'll use the groin. And we run catheters up to where the coronary arteries are in the chest, inject dye, and take pictures. The point of that procedure is to look for blocked arteries. And we do that in patients who are having chest pain or who have abnormal stress tests. So heart catheterization is an invasive procedure, so we're actually putting something in the body, whereas nuclear stress tests, echo, CT scans, those are non-invasive. So it is an invasive test. So there's a couple of situations where we would recommend a heart catheterization. If we're talking about an outpatient that we see in the office, it's someone that typically has symptoms that sound like they may have a blocked artery, and usually they've had some type of stress test that suggests there's a problem with blood flow to the heart muscle. The next step would be heart catheterization. In the hospital, typically it's patients who come in to the emergency room having chest pain, sometimes a major heart attack, sometimes a mild heart attack. But if we detect just about any degree of heart attack by blood work, then we're going to recommend heart catheterization for those patients. Heart catheterization is actually a very quick test. It usually takes less than 10 minutes from the time we start just to take pictures. We do it in the cath lab. The worst part is the table's hard and the room is cold. But we use x-ray cameras, we put an IV in the wrist, and we run long catheters up to where the coronary arteries are. And a catheter is nothing but a long tube. And we have a way of injecting dye down that tube into the artery, and it makes a silhouette of the arteries. And we move and take different angles and make sure there's no blockage in the arteries. So most of my patients are not asleep during the procedure. We give everybody some sedation. I like to say most people are drowsy, but we can talk to them. I tell them it should not be a painful, uncomfortable procedure. Putting the IV in is kind of like getting stitches where we have to numb it up. So generally it's very well tolerated, and most people are surprised because they were expecting some horrible experience, and when we're done, they're kind of surprised we're already done. We always like to make sure patients know what the risks are. Risks are fortunately very uncommon, but if you're the patient that has a complication, then the chances for you are very high. So we let them know, even though it's a very routine test that we do all day, every day, there are complications, so we still want to make sure we're doing it for the right reason.